Welcome back to the Abundant Practice Podcast. I'm your host, Allison Pereira, founder of Abundance Practice Building. I'm here with Sean Hershey, who I have known for years and years now. He is one of our students from way back, and I'm really excited about his topic today because I feel like it's going to help all of us be better clinicians. So thanks for being here, Sean.
Thanks so much for having me. And I mean, true, it is true. I was an abundant student years back, 2000 or to 2021 when basically started my practice. And I mean, I just have to say thank you to you because somebody in one of your podcasts or some post you put out at that time said like, I just followed Allison Ferrier's advice and now I have a private practice. And I was like, okay, that sounds promising. Let me just do that. And now I have a private practice. So truly, thank you for everything you do to help all of us. It means a lot.
Absolutely. Yeah. And now I'm glad because you're going to get to help everybody. Um,
Yes,
should we do some origin story? Because your niche, you switched your niche.
I did.
Can you tell us some of that process, how you landed where you landed, and what we're going to talk about today?
Yeah, yeah. Oh, okay, yeah, yeah, yes, yes. So today we're going to talk about chronic pain and treating
Hmm.
chronic pain from an emotional and psychological standpoint. And
Hmm.
truly, like the work I do now is helping clients heal from chronic pain and chronic symptoms using emotional and psychological modalities. And most people don't even know that's possible, but
Hmm.
it is. And I certainly didn't know that was possible. When I started my practice, I was working with LGBTQIA plus clients dealing with relationship issues. Like, attachment would be my language for it, but
Hmm.
that would be like more the client's language for it. And then I personally had this like very eye-opening journey with my own chronic pain symptoms. Like I had terrible, terrible IBS for many, 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 many years, irritable bowel syndrome,
Hmm.
many years during my 20s. And so many hip pain, so many different symptoms that have truly, since I started doing this work for myself, improved significantly or gone away entirely. Um, it has been so profound for me and such a different mindset that I just didn't know anything about. And I'm like,
Hmm.
I need to this is it now. Like this is it. And so now I have changed niches and I mean I basically do both, but I know from abundance, pick one and market that. So
Hmm. Yeah.
so this is what I'm marketing now, and it's been very fun. I get a lot of clients. It's been slower, and we could talk offline about maybe why why that is, but it's
Hmm.
been slower from a business standpoint, but it's been very deeply gratifying from a personal and clinical standpoint because I relate so much to the work. It's been so fun and it's awesome.
Hmm. Yeah, it's interesting. I remember, so I've had stomach issues my entire life. And I think when I was like 19 or 20, I was at the gastroenterologist, and the gastro said, you need to work on your anger.
Yes.
And I
Okay.
was like, what anger? I don't even know what anger feels like. What's that word? Yeah, it took a while.
Yeah. I'm like you at that age would have been my ideal client.
There we go. Yeah, yeah, totally clueless about the emotional link to, like, I mean, somaticizing everything like a champ, man. That was a muscle I really developed.
Same,
Yeah.
same. And honestly, I'm very excited to speak to your audience of therapists about this today because many of us are sort of wired that way. Like
Hmm.
many of us are very sensitive people, people who feel a lot, and people whose bodies take on a lot. And in our society, we don't really, I mean, yeah, we'll get into it, but like we don't really, we're not really taught like, oh, IBS might mean anger. It might mean sadness. It might mean grief. It might mean anxiety. I guess that's a little more so. People sort of talk that way, but a lot of times, like, oh, you must have gut dysbiosis. You must have something. You got to get a colonoscopy. We got to do allergy testing. And it's like all that is relevant because that may be the case, but that's
Hmm.
not the only thing that could be causing a problem like that. And similar with back pain, neck pain. I mean, there's a lot for us to talk about.
Yeah. Okay, let's do it.
Yeah, all right, let's dive in. Um, so okay, I put some notes on my phone, so I'm looking at these. Like I said, I'm really excited to be talking to your audience of therapists today because most of us feel very professionally and honestly personally um, disempowered when it comes to dealing with somatic complaints and dealing with physical complaints. Like
Mhm.
most of us weren't trained this way. Maybe some very old school sort of psychoanalysts were trained more in like somatic stuff. Um,
Mhm.
and then very new wave might be, but people might be trained in somatic stuff. But for most people who went through a mainstream psychology or social work or program, similar, most of us weren't taught about how to deal with somatic complaints, or we weren't taught like thoroughly. And so we feel very disempowered in working with clients with physical symptoms, and we're taught that they're like not even within our scope of practice. So it seems like it seems possibly unethical to even suggest that a therapist could work with somatic complaints. Not true. It is within our purview. But the opposite side is also true. Medical education is really lacking in an understanding of emotions and how emotions affect the body. And so they feel very confused and clueless about how to treat somatic complaints. And so there's a massive gap. And it's not only for our patients and our clients, but it's also for us. Like we are like everyone listening to this podcast is a human with a body and a brain, and you are susceptible to mind-body conditions just like me. And so it's just such a huge gap in our both in the medical field, in the mental health field, and in society that I'm like, let's talk about it. So yes, what I want to talk about is a new way to understand pain. So if some people listening might be familiar with some of this stuff, so what I'm talking about is the work of Dr. John Sarno, who wrote a
Mhm.
book called Healing Back Pain in 1991, and he wrote many other books. That's his most popular. Um, I'm talking about something called pain reprocessing therapy, which or PRT is the acronym. It's not necessarily mainstream yet because it's that's kind of new, pain reprocessing therapy, but it builds off of the same theories that Dr. John Sarno posited in his book. And I'm sure some of your listeners have heard of that stuff. And like I said, I mean, this has been so profoundly helpful for me personally. Like after my like decades long struggle with IBS, dealing with those symptoms through an emotional and psychological lens, truly, like I do not have severe chronic IBS anymore. Like that's
Mhm.
over. And I still have a sensitive stomach and I still have like emotions land in my body, in my stomach, but now I know what it is and it doesn't scare me and I know how to deal with it. And not so what I'm offering, and what I'm communicating to your audience today is very different than CBT for chronic pain, which is how to manage your symptoms. Something's clearly wrong with your body, so we've got to work on how to manage your life so that it's so you can still live a good life even though you have something wrong with you. This is very much not that. Dr. John Sarno's work and the mind-body work that I do in pain reprocessing therapy is very much about like you don't have to have chronic symptoms. Like yeah, you'll experience pains in your body. Everyone does. There's many, both emotional and physical. There's many reasons why you will experience pain in your body in your life, but you do not have to have severe chronic pain. If you treat it psychologically and emotionally, the symptoms can come way down and even go away. So what I'm
Mhm.
not talking about is how to manage your chronic pain. What I'm talking about is like how to learn to let it go and like truly
Mhm.
live without it. So it's just very exciting. And I hope people listening are like, wait, what? Like, is this possible for me? I want to list so people can recognize this. I want to list some like classic conditions that where this might be manifesting. So, like classic ways that mind-body pain would manifest in the physical body. It's This paradigm applies to many cases of chronic back pain, chronic neck pain, chronic hip pain, chronic shoulder pain, chronic knee pain, chronic elbow pain, pain from disc bulges in the back or neck, pain from disc degeneration, other musculoskeletal pain, sciatica, neuropathy, migraine, irritable bowel syndrome, as we've been talking about, pelvic pain, interstitial cystitis, fibromyalgia, chronic fatigue syndrome, complex regional pain syndrome, sometimes called CRPS, and more. I mean, there are many ways in which the psychological and emotional factors manifest in the body, but those are kind of classic heavy hitters that many people will recognize that most people don't think are, if somebody has back pain, they think, I must have a slipped disc. I maybe need surgery. I need physical therapy. And while maybe, but maybe it's something different. And that
Mhm.
is what I want to talk to your audience about today. And so here we are talking about it.
Yeah, it's interesting because I think about how, just like with my own medical history, it's like, okay, well, stop eating these things and see how that feels. And, do these kinds of stretches or exercises and see how that feels. And those things for me, as somebody who tends towards the rigid, I'm like, excellent. Let me put it on my to-do list. I will knock it out. I will give it an A plus. And then nothing's changing, or it's only changing a fraction.
Yes.
But diving into the emotional side of life and really feeling it is so much harder and I'm so much more willing to neglect that and not put it on my to-do list
Yes.
than, some physical therapy exercise or, not having coffee.
Yeah, 1,000. Okay, first of all, same. Like,
Hmm.
the same. It's like, give me a to-do list, I'll do it. For
Hmm.
example, the abundance checklist that you offer, I
Hmm.
did
Right,
it.
right.
It's so helpful, so helpful. And that's something that I actually work on with a lot of my therapy clients is there's a difference between most people with chronic pain have it's easy for us to become kind of like obsessive and treat ourselves as if something's wrong with us. And any kind of intervention that's like, you need to fix something wrong with you. That's the kind of stuff that most of us will easily gravitate towards and try to do. If the
Hmm.
time is like something's wrong with you and you got to fix it. The paradigm that I'm working from and that I'm helping my clients move towards is like taking care of like the true authentic self, not who you want to be, not who you will be once all your to-do lists are complete, not who you'll be in 10 years once like, once you're fixed, quote unquote. What
Hmm.
I'm helping people do is work with like the real kind of animal self of who you are, even if it's not who you want to be, or it's not who your family would want you to be, or it's not who certainly your family of origin would want you to be, the society would want you to be. It is much harder to work on that person, and
Hmm.
yet that's what chronic pain is inviting us to do.
Right. Ah. So walk us through some of how, and I know you're going to do a much more in-depth training in the abundance party, but like tell us the highlights of how we could be working with people or things we could be asking before we're more deeply trained. Like how do you start with people?
Yeah. Great question. Well, let me say that it really is a very different mindset because people think of pain. Well, okay. So why don't I say a little bit about like I have these notes written down, so I want to say a
Mhm.
little bit about this. Pain. People think of pain incorrectly, or I wouldn't even say incorrectly. People think of pain like not holistically. It's like what we know is correct, but there's also much more. So our mainstream understanding of pain and symptoms in the body is incomplete. So pain is a danger signal in the mind-body system, and that's always the case no matter what the pain or symptom may be. So, say you put your hand on a hot stove, obviously your hand is going to hurt, and that's because your hand is in danger. Say
Mhm.
you get slapped in the face, yes, your face is going to hurt because your face is in danger. So, pain is a danger signal. And we have been trained to believe that pain is always and only a sign that something is structurally wrong with the body at the site of the pain, or
Mm.
that there's some kind of illness or disease at the site of the pain. And that is one cause of pain. Like that's certainly not wrong, that obviously is real. And it's not the only cause of pain. Like that is an incomplete understanding of pain, not an incorrect understanding, but an incomplete understanding. And pain is not always what you think it is. And chronic pain is different than acute pain. It's pain that lasts for a long time, pain that's days, weeks, months, certainly years, which many people have, certainly me included, like that's
Hmm.
my story. Um, Chronic pain is usually caused by emotional and psychological factors, and it's usually not caused by physical or structural factors. So, um, why don't I take just a couple minutes to walk through the three most, like basically the three most common ways in which chronic pain arises. Is that
Okay.
cool?
Sounds good.
Okay, cool, cool, cool. So the three that I teach about are psychological is number one. Or actually, let's do it this way. Emotional is number one. I think that'll be easier to understand. Psychological is number two. And being misattuned and misaligned with your true self is number three. So, number one, emotional. Um, Most people with chronic pain are people who have learned somewhere along the way that like the emotions you feel, like the strong emotions you feel are like not safe, not good, certainly not easy, maybe will not be attended to by others, don't matter to others, and therefore like the emotions that we feel like it's best to not feel it. And we can be very good at trying to fix emotions, trying to solve emotions, trying to fix the things that are underneath our emotions, solve the problems that are underneath our emotions. And that's great. A lot of therapy is about that. And like that's great work. And there are some things that you can't fix for and some things
Hmm.
you can't solve for. And I mean every therapist knows that. And there's a huge difference between fixing your emotions versus just feeling your emotions and allowing yourself to feel your emotions and not being afraid to feel your emotions. And so most of us with chronic pain are the type of people who want to fix everything. We don't want to feel it. We don't like to feel it. And we come by that honestly because usually that's like, we were in an environment that in some way was not validating and did not see us and we were not mirrored and certainly it could absolutely this can come from trauma. um, and so we feel emotions are a threat. So
Hmm.
as emotions rise in the body, which will happen every day, not a day goes by without an emotion.
Hmm.
As strong emotions rise in the body, that feels threatening to the mind-body system. And on an unconscious level, the body will create pain and symptoms because it's afraid of, it's similar to like the hand on the hot stove. It's like the emotions have a similar function in the body. It's like as that rises, the body's like, no, 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 don't like, dangerous. And that, of course, creates a danger signal. So a huge part of the treatment for chronic pain is learning how to befriend your emotions. Because I mean, most of us have a lot of repressed emotions, a lot of stuff we don't like to address. And so, airing out and getting to know and making friends with those repressed emotions is a huge part of dealing with chronic pain. All right, so that's the first thing, emotional pain, where the emotion causes the danger signal, which causes the pain. Second is psychological. So this is the realm in which pain is caused by the sense of threat that causes the pain is the pain itself. So there's something called the pain threat cycle. I mean, it's for therapists who are similar with a panic disorder. It's like that, but with pain, where it's like the thing that gives you the most anxiety is the sensations of anxiety. This,
Hmm.
this is like where the pain when you have, say you wake up with a pain in your neck and you don't know it, but it's because of some emotional situation you're dealing with. And then it goes on, and it's days and it's weeks. And then maybe the emotional situation has now blown over, and that's okay. Awesome. Good. That is sort of resolved, at least temporarily for now. Good. And but the pain may remain because every morning you might wake up like, oh God, my neck. How does it feel right now? Oh, maybe it feels okay. What if I sit up? When I'm working today, what kind of position do I need to be in? Oh, is my neck going to start hurting? Oh no, I think I feel it. Oh God, it's going to be a bad neck day, right? And all of that, that becomes the new danger signal. And that
Hmm.
stresses out your body so much that it's going to perpetuate the symptoms. So there's something called the pain threat cycle, which is like, the more when you feel pain and you're threatened by the pain, pain is a danger signal. So feeling threatened will make the pain worse. And then when the pain gets worse, you feel more threatened, and then it
Hmm.
causes more pain and more threat, and you just like go like down a downward spiral. So what we really work on there, what I work on with my clients there is not being afraid of the pain and the symptoms and learning to reverse that cycle. And that cycle can get real bad. People without certainly through no fault of their own, they're just not familiar with what's going on. They end up bedbound, housebound. People the chronic I think there's a belief that like if your chronic pain or chronic symptoms are emotional in nature, there's no way it could be that bad. Like if it's really bad, something's
Right.
really wrong with your body. And that's not true. These
Hmm.
emotional and psychological symptoms can be incredibly bad, incredibly severe. And so yes, getting out of that is important. All right, last thing briefly in terms of the three um ways in which chronic pain typically rises. First, we talked about emotional, second, psychological. Third is where the danger is like the fear of being your true self. Everywhere you go, there you are. We all know that. And if you're always, I mean, chronic pain usually happens for people like me who have been taught along the way, like, you're not right how you are. You should be different. You shouldn't be this way. You shouldn't be that way. You should be more like this. And everywhere you go, your true self is there. We're all born with a temperament. We're all born with a personality. And of course, the environment affects us hugely. We can develop this way or that way. And yet all of us, like we are all a real person who has a real
Hmm.
personality and like we come into the world with something. And if you are trained to dislike and try to repress whatever's inside you, that will be there all the time. And
Hmm.
so everywhere you go, you may be feeling threatened by your true self. And this is some of the hardest work. It certainly has been for me, and it is for most people who are on this path. Um, but making friends with yourself and allowing yourself to be yourself will drastically help with chronic pain. Drastically.
Hmm.
And people like that's a far leap for a lot of people who are like, wait, but I need to get I need to get an MRI, I need to get an X-ray. And to just say, like, you actually need to befriend your true self is like so leap for so many people. But but in most cases, it is actually true. And so it can be kind of a long on-ramp. Like I start with people with like the education and the emotional stuff, and usually getting into like being yourself and learning to love yourself and just learning to even just like it doesn't have to be so dramatic, like you love everything about yourself, but just learning to tolerate yourself would that like that's like a later phase of treatment. So okay, last thing I just want to briefly say, Dr. Sarno has a list of personality traits. This is a list of traits for people, typical personality traits that people have who fear their true selves, and typical personality traits that people have who develop chronic pain. And a lot of people relate to this stuff, and a lot of therapists have this personality profile.
Hmm.
Perfectionism, goodism, wanting to be seen as good by others all the time, people pleasing, high conscientiousness, stoicism, low self-esteem, and highly self-critical. So a lot, I mean, I certainly relate to like basically all of that. And I know
Hmm.
a lot of your listeners will and a lot of therapists will. And so what I want to invite people into is like if you or the clients who you have are experiencing chronic pain and have that kind of personality profile, there's a good chance that this is what either they or you are dealing with in their body or in your body. And the good news is like there really is hope for this. It can absolutely get better. Like if you treat the symptoms emotionally and psychologically, you can be doing worlds better. Like the symptoms will go down significantly, go away in many cases, certainly not be chronic anymore. There's so much hope. Um, and so I want people to know that because like I needed this information so long before I actually got it. So
Hmm.
it feels good to be able to share this with people, and I hope that this lands with some of your listeners and that they that they feel hopeful and
Yeah.
maybe are because this can be a really big awakening. Like for some people listening to this, it might be like, oh, wow, wait, could this be true for me? And that is a huge awakening. And so I just want people to know there's a lot of hope for these conditions.
Oh, I love it. Thank you so much, Sean. I'm like trying not to massage my shoulder right now. I'm like, okay, okay. I'm excited about the training you're going to do in the party because well, you know what's funny? I have had Sarno's book on my shelf. I'm not somebody who has a big stack of TBRs, but I have had that book on my shelf for maybe a decade because so many people have recommended it to me over the years, and I just keep not reading it. So I'm going to take this as a sign to like pick that sucker up and read it. So, yeah.
It's very life-changing for a lot of people. And it really,
Mhm.
I mean, one of the things that they say in the world of chronic pain treatment is, and this is a Dr. Sarno quote, denial of the syndrome is part of the syndrome. Because
Hmm.
if your emotions are repressed and if parts of yourself are repressed, you're protecting yourself against that, subconsciously.
Hmm.
Like, you don't want to just pick up a book that says, like, explore your emotional life, because there are
Right.
parts of you that are like, don't explore your emotional life.
Yes, yes,
It's so
most of
very normal to
me.
have a book on. Yeah.
I love how like many of us therapists are like, no, I mean, feelings are really important for you to feel, but not
Yeah.
so much me. I don't
Yes.
wanna.
Yeah. 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 And we're very good caretakers and they're
Hmm.
helping others. And oftentimes, like, we're not on the list of people who like deserve care and support, which
Hmm.
certainly has been the case for me and still is the case for me in many ways. And it's something I'm like still working on. And but like we're people too.
Hmm.
We all of us deserve self-care and care by others. All of us deserve that.
Yes, yes. Awesome. Well, I will see you soon, Sean, and thank
Well,
you so
hold on.
much.
Let me say for people who will
Yes.
want more, I have a podcast of my own. So let me just
Yes. Oh,
quick
yes. Thank
plug
you.
that, which I actually learned from you that the best kind of marketing provides a service. And
Mm.
that's honestly kind of the inspiration behind the podcast that I have. So I have a podcast, it's called Mind Body Medicine for Chronic Pain.
Hmm.
Apple, Spotify, wherever you get your podcasts, you can find it there. And the deep dives on a lot of stuff. Like I've got a bunch of
Nice.
episodes at this point, lots of interviews. I think it's very good, and it very much is in the abundance mindset of
Uh-huh.
the podcast really does provide a service. It provides a service for people who want more information about this, people who don't know about this, it really is very educational and also fun. I think the podcast is very fun and kind of inspiring.
Hmm.
It's like good vibes. And it does market my practice. But the cool thing
Right.
is that it's like if people want to go deeper and would want to work with me, then great, they can reach out to
Hmm.
me and all my information is there. But the podcast itself is really helpful and it's totally free. And
Hmm.
it's very abundant. So happy to share
Awesome.
with you and your audience.
I love it. Yes, we'll make sure we put a link to it in the show notes so it's easy to access.
Well, sounds good. Sounds
Awesome. Yay. Well, I will see you soon. Thanks so much, Sean.
good. See ya.